And now Dr. Drew is a lesson in resilience. And oppression is just one of many forms of psychological trauma, psychological stress that we endure in life. And whether our stressors are due to fractures or surgical procedures, falls, traumatic injuries, infections, or emotional traumas, our ability to bounce back from these, the extent to which these traumas leave a scar, is really all about resilience. And resilience is a topic that is really important for all of us to grasp and to embrace, because our physical resilience and our psychological resilience are both somewhat different but very linked markers of our health and well-being. In fact, one of the best ways to define health is our ability to bounce back from the shocks of life. Of course, when we're at rest doing our daily routine, the absence of symptoms is a good thing, but the absence of disease is not what defines health, as many of us in integrative medicine love to say. The spectrum of health has extreme debility and death at one end, and many people live within the spectrum that we call unwell or ill. However, many of us, most of us, fortunately, are what normal. You know, maybe we have a little upset stomach now and then, maybe we're prone to headaches, maybe we don't sleep well every single night, but generally speaking, if your body works, if there's nothing that seems broken, you would define yourself as healthy. But when life hits you, you find out how healthy you are, whether it's bouncing back from a terrible loss or a grief, or whether it's how you endure an intense stress in your life, or the intense stress of the world we live in, whether it's coping with your illness or coping with disease that affects your health in a tangible, physical way. Psychological resilience is probably the most important of the two. Why? Because it's the one that's most modifiable by choice. So while your ability to a viral infection might not seem to be up to you, in fact, there's very good evidence that psychological resilience influences the function of the immune system. And a systematic review that includes animal studies and human studies limited to psychological resilience points to very clear relationships in both directions between the health of your immune system and your psychological resilience. Now, this is important because inflammation that can be present for a variety of reasons is now recognized to change the brain, to cause subtle changes in the pathways that govern how we think and how we react, and even affecting our core beliefs, depending on how inflamed our brains might be. Now, it's not just about brain inflammation. Of course, when we're inflamed, our choices as far as foods are concerned are different in subtle but important ways. Our tendency to engage with others when we feel sick or under the weather is reduced. Our desire to be physically active and to move and to be outdoors and to see the sun is altered. And even our muscle tension and the baseline level of The tone of our muscles, governed by our nervous system, is altered. We curl up when we're sick. Conversely, when our resilience is altered by a lack of social supports or by a lack of mindfulness, a lack of compassion, there are several predictors of psychological resilience that are used to define people who choose forgiveness, who choose optimism, who believe that their life is up to them, who recognize the need to take action, who guard against overthinking and that downward spiral of feeling sorry for oneself and thinking that the world is against you and assuming that nothing is worth doing. These are feelings and thoughts that we all have sometimes, but recognizing when they're occurring, noticing what your brain is doing, and not assuming that every thought deserves your attention just because it popped into your head, is really an important meta life skill, because not being your brain is the only way you can escape from the prison of your brain. And how you interpret any situation, no matter how dark it may seem, is entirely up to you.